in terms of what, you know, in terms of as a community, things that we need to think about, is just give you a little bit of background information, but from a different context from what you probably hear on the news on an everyday basis, and also talk about the different stages, and then talk about things we need to think about in terms of preventing it and managing it individually and as a community. So I guess the first question is, why all the fuss? Why all the, you know, scaremongering, etc. Although some of it I think is a little bit OTT, but so I'll just start with a little bit of information, because when it comes to health, especially Black health, it seems to be a uniform struggle, you know, a bit like the Black Lives Matter. So I don't know why this thing is going before I want it to. You've probably all heard most of this in terms of, if you're Black, you're more likely to, you know, be admitted to hospital or die. But I think the key things I just wanted us to remember, for the benefit of people that may be affected by any of these diseases or may know someone, is that obviously the risk is much increased if you've got one of these conditions in terms of diabetes, cancer, being overweight, obesity, sickle cell. We're not too sure. The jury is still out, although now we're getting more information to confirm this. But in terms of, if you've got something like asthma, hypertension, you're on certain medications and you're overweight, there's still an increased risk that you might get it. And if you do get it, it will be more severe. And I think that's the key point to remember, is the severity. Okay, so same thing, same story in the UK, not much difference, probably even worse if you're a male, if you're a Black male. But bear in mind that men in general are a little bit more vulnerable to this disease. And Public Health England, same picture, nothing different in terms of what they're saying statistics wise. And this, I want to just talk a little bit about this. This is a really reputable medical journal, the LANCET. Some of you may have heard of it. And the reason why I've picked this out is because I feel it's a lot more specific and relevant to us. Basically, they kind of analyze data across almost 100% of general practices in England in particular. And they looked at people with type 1 and type 2 diabetes especially. I know type 1 probably not as common in our community as type 2, but type 2 definitely very, very, prevalent within our community. So, and what they found out, just to summarize, and what they've said is that if you've got diabetes, you're gonna be at a higher risk of dying at a younger age. I guess that kind of goes without saying, because if you've got diabetes, you know, you're more vulnerable to a host of other things as well. But I think the interesting things to point out is that they've kind of said that people that have a history of heart disease and stroke, there's much more people likely to die within our community. And they've kind of, before, remember I said before the statistics was a little bit like, oh, maybe if you've got hypertension, they basically said categorically, if you've got diabetes, heart disease and hypertension, those chronic diseases and weight. So those four things are key in terms of, you know, like your risk of death or your risk of getting this disease in terms of severity. So just a little bit about the stages. So just to summarize, this is the way I look at it is that this thing has three main stages. The first stage is the pre-stage. That's the bit that I think the government is really honing on, like infection control, where we talk about washing our hands, social distancing. I think in the book that I wrote, I talked a little bit more in depth about some of the less obvious things when it comes to infection control to think about. But this is where our bit is to basically follow the advice they give as best we can. And then vaccinations as well. There's a lot of talk, and I'll talk a bit more about that in a minute. There's a lot of talk about a vaccination for COVID-19. But I think it's not just vaccines, the COVID-19 vaccination we need to think about at this stage. We also need to think about other vaccines that we should be getting, and especially if you've got diabetes, and thinking about it from an individual risk, a community risk, and also preventing yourself from getting other infections that may actually have an impact also in terms of you getting COVID-19 or the severity. And then obviously there's the testing, where we all know by now, or at least we should know by now, that if we have symptoms or we think we've been exposed, then we really need to make sure we get tested. Then the second stage, which is what I call the anti-stage, is just to highlight that majority of people, I think the figures are about 80% of people will probably, thereabouts, will probably just get a mild to a moderate infection. So I think that should be comforting. This is the bit that I think the media focuses on so much that people forget that 80% of people will get it and probably be okay. They focus on this minority because that's, I guess, what makes the headlines. Probably about 15% will get it on a really severe basis, and then 5% will probably need to go into critical care. Most people, when they get symptoms, they'll probably last about 2 weeks, give or take. And I just also want to mention here, which is why I'm doing this talk and why I think we need to think a little bit broader than COVID-19, that it is possible to get another infection when you have COVID-19. And that's been seen in about 20% of people that have been admitted to hospital. However, I also want to talk about antibiotics, because there's a lot of people that, you know, whenever they get a cold or a flu, they turn up and they ask for antibiotics. Now, I really want us to stay away from this, because I think in this area, antimicrobial resistance is something that is real. This was one of the things I did my MSc on, and I did it on a sort of international sort of basis, where I looked at, you know, the challenges around antimicrobial resistance, both in Africa and in the UK, kind of like a high income stroke low income thing. And it's a big issue. And so I think I just really wanted to use this opportunity to highlight the fact that most of you will not need an antibiotic. And in fact, there isn't an antibiotic that will do much for this thing. So it's a viral infection, and most of you, when even with the flu, don't need antibiotics, kind of thing. And I just really don't want us to, you know, during this pandemic, to then run out of antibiotic and just make things worse for a lot of people. And then recently, there's been a lot of talk in the news about long-term COVID, and I call it the post, so after the main course. And that seems to be associated with chronic fatigue. The other thing I really want people to think about in terms of reducing their risk of long-term COVID is that it's also associated with the risk of you getting, so people that previously had things like diabetes, etc., we're finding that some of them are starting to, basically their whole body, their, you know, how things work in the body is changing. And then people that already have some of these diseases we're finding that they're getting, the controls getting a lot worse. And then we're also finding that there is a risk of people getting clots. And let's not forget about people's mental health and their social health. I think that is often sort of forgotten. And that's a big issue, especially when it comes to long-term COVID. So, and it's just something I think we all need to be aware and just be a little bit cautious, because, you know, it's not predictable. It's not something, the post case scenario is not necessarily if you're old that you're going to get it. We're seeing young people get it, people that were otherwise fit and healthy, and sometimes they think they're, you know, they're over the infection, that they've moved on, and then it hits them. So we just need to be vigilant around this as well. So let's talk a little bit about the whys and the hows of long-term COVID-19. So, I mean, health inequalities, I mean, let's just put that to one side, because that's always going to be there. And there's people there that that's their job, that they should be really in trying to improve things in that respect. So I just want to highlight here. So there's a lot of, there's a lot of talk about the mechanisms of this, and I'll just summarize it without getting too technical. Essentially, what they're saying is that, there are some people that the reason they get long-term COVID is because their body is unable to mount a full immune response to the infection, and so they have some of the viruses lagging behind. There's a possibility that it might just be a case that people relapse. Some are saying that it's because their bodies can't adapt back to normal. And also they're saying mental health again pops up again, that it may be linked to post-traumatic stress. So I think in summary is just to think about, what we can do to make sure we're functioning really at as best our bodies can function, kind of thing, because the risk of long-term COVID-19 is essentially really due to our immune systems not functioning as well as they should, and also being stressed out more than normal. And some other important points I really wanted to highlight here was, and this is where I really want us to, the media is great, they keep us aware, etc. But I think sometimes it feels like they're trying to dictate the agenda of this whole thing, and it's not actually the health experts that are dictating the agenda. And I think we need to be really careful. So long-term consequences of infections is not a new phenomenon. It's not something that doesn't happen or hasn't happened before. We see it in sepsis. Those of you that are familiar with sepsis and know about sepsis, almost 50% of people that get sepsis tend to have long-term effects of it. We've seen it with other coronaviruses in the past. In some cases, there are reports of people for up to 3.5 years having this. We've seen it with HIV. HIV is a bit different because it's a chronic disease, but I've mentioned it because it's an infection. And initially we felt, oh, we've got the drugs, we've treated people, we're home and dry. We now know that that's not the case. A lot of people with it are actually we're seeing that even though we're able to treat their HIV and, things are in a better place, that, can we keep an eye on the waiting room, please? We're seeing that, patients are starting to develop other conditions because they still have some viruses lurking about. And this is what we see, like I've kind of mentioned previously, in terms of, like increased inflammation, your risk of clots, and then, your blood's not quite being what they should be. So what do we think in terms of management? So I kind of look at it in two phases. There's the medical side of things where we're aiming to control your symptoms, and we're also looking to improve the control of any long-term diseases you may have or minimize your risk of getting such. On the other side is your part and what you should be doing. And I think what you should be doing is focusing on your health and well-being. If you're someone that's taken it for granted before, regardless of what age you are, you need to pay a little bit more attention in this season to it, because that's what will get you over the finishing line. And rest and relaxation, and also pacing yourself and having a good exercise routine. These are all things that is down to you to do. So I've said here again, and you'll understand a bit later why I've said some of these things, and that's that some people, in a lot of people, I think support should be personalized somewhat, because what we need and what needs to be done, it may be specific in a lot of cases. And, we'll do the best we can within the NHS, within the context of the NHS, but in a public health system, resources is always a challenge. So we can't always deliver that gold standard that we want to all the time. And then obviously other long-term diseases that I've said. And like I said, this is a time where I think we also need to just work together and be our neighbor's keeper. So, a lot of people struggling socially, financially, and also from a cultural perspective. I don't always think the way healthcare is delivered is culturally appropriate for all of us, at all times. So, these are things as a community we need to look inwards and try and work on. So, so I'm just going to talk a little bit about medications and supplements. And there's three main elements I want to cover in this part. One is symptomatic control. Most of you, or most people that get it will probably need symptomatic control. And that would be mostly your over-the-counter products and your home remedies that will help to give you some comfort and some relief from some of the symptoms you may get. Most of those things you can get from your pharmacy. So you probably don't even need to go to your doctor, most times. And, I think I've had a few patients call me, but most times I've kind of just said, go to the pharmacy, pick up XYZ kind of thing, and that should help to manage your symptoms. Then the next thing is, are there any game-changing medications? And there's been a lot of information ever since the beginning of this thing about game changers. Trump became a medical expert overnight because he felt, he could announce game changers. And then another thing is, are there any gaps? Can we fill some of these gaps with supplements? The supplement industry is very, very active as well. Everybody's trying to get in there and get a piece of the pie. So we'll talk about all this now. So what, if any, game changers are there? Let's start by looking at treatment, things from a treatment perspective. So there are various trials being done all around the world. The challenge is, in all honesty, data is coming at us at an unprecedented rate, like we've never seen before, the speed at which data. The problem is that the standard of this data is not uniform. Some of the data a lot of the data, in fact, is quite questionable. And I think, people like the BMJ, the LANCET have been doing a lot of work to try and actually evolve the way we process data in order to maintain some sort of standardization and make sure that we're getting the right data the right way, kind of thing. But one of the ones I want to speak about is the Solidarity trial, which is being done by WHO. And I think the reason I've mentioned this is because it really shows us the importance of having those good trials. I know for most people, Joe Blogs, whatever the media says, they just go with it. Some of us that maybe work in healthcare are a little bit more specific and look into things in a bit more detail. But I'm highlighting this because a couple of months ago over the summer, Trump's, in fact, not once, twice. The first time he stood up at the beginning when this thing started and announced he was taking hydroxychloroquine, and that's a preventative drug. And Twitter and social media went mad and everybody jumped on that and said hydroxychloroquine is the answer in terms of not getting it. I remember I did a few locums at that time and people came into the shop and were like, oh, can I buy some hydroxychloroquine? And then, not long after, he was like, oh, America's, announced a cure. They've got remdesivir. That's going to keep him in power. That's going to win the election. We're on top of COVID-19, nothing to worry about. And these comments were based on really small trials, and the media took them on board. The trial WHO has done is a lot more standard. It covers over 500 hospitals in several countries with a lot of patients. And they basically have looked at the risk of death, the need for ITU, critical care, and the length of hospital stay. And as at last month, when they released the interim result, it actually showed us that remdesivir had minimal effects on treatment outcomes. It showed the same thing with hydroxychloroquine, and it showed the same thing with a couple of other drugs that people had been talking about. It was good old-fashioned dexamethasone, a very cheap steroid. That was the one drug that was seen to be effective. And there are other newer drugs being investigated. So I think, we're in a good place in that we have a few things. We now know that we can manage the symptoms. So I really wanted to say that more to reassure people that if they find themselves in that situation where they have got it or they have got a severe infection, that it's not, there are things that can be done to manage you. So I really don't want people to, I want us to get away from living in fear. So prevention. So what are the game changers in terms of prevention? So I think most of what's being talked about is a vaccine. And I know me personally, this is where I disagree with the approach the government is taking with all these lockdowns. I think, without being critical, because I know that, they do the best job they can, but I think this lockdown, etc., we've got to find a better balance of this. Now, there are over 300 vaccines at the moment in preclinical trials. In all honesty, a minority of those will actually make clinical trials, and very few of those will actually succeed. The idea that we'll get a vaccine early next year, I think, is very ambitious. And when I think about the fact that even the flu vaccine this year, what they had been saying to us is that we're going to vaccinate everybody, not just the over 65, but also the over 50s. Most surgeries haven't even finished vaccinating the over 65s, talk less of the over 50s. So it's one thing getting the vaccine, the logistics, the distribution, all those need to be thought about. And also, we're probably going to need different versions of the vaccine. Similar to the flu vaccine, it's probably only going to be partially effective. There's been a lot of talk about herd immunity, which basically, is the principle that, you build up immunity in the country, more people get it, either through giving them a vaccination or from them actually getting the infection. And that's help, and that will go some way. But the effect that they're talking about, where life stops until we get this vaccine and we get this effect, is not realistic. And it's not realistic because we have some herd immunity with the flu. That's why it's important that you get the flu vaccine. But compared to things like smallpox, polio, where we've actually been able to eradicate some of them because of that concept of herd immunity, it's probably not going to be the case here. So it's important. I just feel like we need to stop planning our whole lives based on this magic vaccine. And then, is there a role presently for vaccinations? And I want to say, because I know there's a lot of conspiracy theories around vaccines, so that's why I'm saying this. And there is definitely a role for vaccines. I think when it comes to vaccines, many of us have often underestimated and not gotten the flu vaccine, especially if you're over 65, but even if you're over 50, and listening to this, the flu vaccine is an important vaccine because although it's not 100% effective, it is quite effective and it will decrease your risk of getting flu. And even if you get the flu, we know that when you have the vaccine, it's not going to be as severe as it can be. And what that means is that it will keep people out of hospital. And if you were able to keep people out of hospital, then that is another avenue by which we can decrease their risk of being exposed to COVID-19 or of getting another infection, etc. So it's really important. If you're listening, even if you don't necessarily fall into a high-risk group, if there's someone around you, your family, your friends, speak to them and just make sure they've got it. It's free for people that have a condition, or for people that, are of a certain age. So, let's be a bit proactive. The other vaccines to think about is the pneumococcal vaccine, which will decrease your risk of bacterial pneumonia. Again, it's not 100% like the flu, and we're quite specific in that we only give it to people over 65, and I think for people with certain conditions. But it will decrease your risk of having a pneumonia, as well as going into hospital, as well as having, if you have COVID-19 or the flu, the last thing you want to do is have a bacterial infection or pneumonia on top of that. So these vaccines, there are vaccines that you should be getting. The shingles is another one. If you're over, I think that's between 70 and 80. So I think the take home, what I would be saying here is that, is to check whether you need to have one of these vaccines. If it's not you, check if your family, if your friend or, your parent or your auntie or anyone needs it, that they're up to date with their vaccines, because these things do work. They do make a difference. I devoted a whole chapter in my book for people that have read it about vaccinations, where I talked about some of the conspiracy theories and the value of actually having these vaccines. So I think just to summarize in terms of, the take-home message, I think as a community and probably as a society, we need to find that right balance between mitigating the risk of getting COVID-19 or of getting it in a severe way and day-to-day living. And we need not to forget about really probably the most proven preventative method will be us living healthily in a holistic way. And I think that with all the news going on at the moment, I think that key thing is forgotten. And I think as a community, bearing in mind some of the challenges and vulnerability we have, I think that's something we really need to run with in this time. So let's talk about filling the gaps. How am I doing for time? Not too bad. So herbs, vitamins and minerals, is there a role for this? I think it's fair to say there may be a role for this kind of thing. There's a lot of research ongoing, especially to do with vitamin C, vitamin D and zinc. That's probably where the most research is going on. I know earlier on there was some talk about zinc and hydroxychloroquine and vitamin C being used in a preventative measure. A lot of those trials, some of them are still going on. I think, you know, like there's some talk that, okay, if those things can't be used on a treatment basis, let's see if we can make them work to prevent, you know, COVID-19. At the moment, I have to stress, there is nothing to say that it can. In fact, what we're seeing from some of the studies where they looked at things like zinc, azithromycin, which is an antibiotic, and hydroxychloroquine, what they found out is that people's risk of, you know, having heart rhythm problems were increased because of the way those two drugs work. So there is nothing yet, but there is still research. It's not, you know, it's not down and out, because there is some talk about maybe if we change the dose, maybe if we change the time at which we give it, then maybe it will make a difference. I think key when we're talking about vitamins, minerals, and I just want to stress this, especially with things like your vitamin C, your vitamin D and others, we really need to think about the dose, the bioavailability and the context in which we're taking. Those of you that attended the last talk, remember that we touched on this, myself and a dietitian, Shala, I call her Auntie Shala, who's also watching today. You know, we spoke about this in a bit more detail, but there is a role for these things, in my opinion. It really depends on how much you take, when you take, and in the context in which you're taking. And I'll use vitamin C as an example. So vitamin C, you know, for it to actually have an effect on you, most times in terms of like using it as a treatment, you need to take a decent dose. Most of the doses on the packets of stuff that you buy is probably not enough to do much. You know, for most people on a day-to-day basis, if you're having an orange a day, that's probably about 200 milligrams. And that's probably something over a long time that you want to be doing. Now, if you actually feel an infection coming on, that's when you want to take a bit more. You know, that's where we have some information to say it can actually, you know, shorten the duration of an infection or the severity, but it's taking it at that key point. There is some information out there, not probably something I have a lot of experience on, but I know that there is cases of people giving people really high doses intravenously, but that's not something most of you probably need to think about, because we're hoping that most of us here don't need to, you know, find ourselves in hospitals and need to deal with that. And if we are in hospital, then there will be the expert dietitians, the expert pharmacists and doctors that will take care of that. But just on a day-to-day basis, I just want people to think about when they're taking these things, to, if they're getting it from the pharmacy, ask the pharmacist, you know, if their doctor's recommending it, you know, just check and make sure you're taking the right amount in the right way, in the right context. So I just want to say, so Black people, like I said, tend to be more affected on balance by a lot of these comorbidities and this infection, which generally have an impact on your immune system, and also means that there's a lot of internal inflammation that could be going on, which is where some of these things may help. They may not be a cure or treatment, but they may be able to help in terms of from a supportive point of view. So we also need to think about other factors that affect us as Black people. So things like melanin. Melanin plays a big role, especially when it comes to vitamin D. Our age, hormonal imbalances, you know, weight, all those things play a role in terms of how much of everything we get into our system, and also in terms of how a lot of medications affect us. And so I also wanted to say that as well, because when a lot of people, certain disease states and medications can affect, you know, how much of these nutrients that you actually have and you take in. And that's where sometimes there is an argument that, you know, having a multivitamin, I'm not always a massive fan of multivitamins, because sometimes you can end up taking too much of something you don't need. So it's all about context, and I'm a little bit more extra and specific. But what I'm saying is that there is a role. And if you've got something like diabetes, hypertension, and you're on medication, you know, there's probably even a bigger role for, you know, you to make sure. The best thing is for you to be taking a varied diet, but sometimes that's not always possible for a lot of people. And I think the requirements are likely to be more of an individualistic thing. So it's not going to be a case of one size fits all. So what are some of the hows and the whys? So these are some of the reasons why supplements may help, kind of thing. And lockdown, most of us aren't going out. Most of us, even before lockdown, were struggling when it came to, you know, especially getting enough vitamin D, you know, and I use even myself as an example. I consider myself as relatively healthy, but I think at the beginning of the summer, I paid a rare visit to my GP or spoke to them. I rarely speak to them. And I had a little bit of an argument with the doctor that I spoke to because I wanted to have a vitamin D test. And I was like, well, since I'm doing some tests, just test me for vitamin D as well. And they were like, oh, and I was like, yeah, don't forget I'm Black. So it's probably going to be low anyway. So they kind of reluctantly did it. And surprise, surprise, it was low. Now, I try to eat healthy. I've worked throughout lockdown, so in terms of exposure, so talk less of people that are indoors all day. Most of us, there is an argument. I think then it's about how much we should be taking. Public Health England says everyone should take 400, but in practice, we generally say people should take twice of that. I'd never recommend 400 for a Black person because we have melanin. The way vitamin D works is that we need enough UV light to penetrate us. Number one, we don't get enough sun in this country. Number two, even when we get enough sun, because we've got melanin, we need more of the vitamin D to actually have the same effect as it would have in a less Black person or a white person. So, you know, and then if you're someone that are indoors or you work shift work, etc., these things all play a role, as well as if you've got other disease states, you know, some medications, etc., can have an impact. So that's another example of something that why supplements may help. Then in terms of COVID-19, we know that there's a lot of stress. We know that there's a lot of processes going on in our body that are releasing chemicals, and some of these things may help to balance things out. So, you know, I keep on saying this, I'm not, you know, like against these things. I just think we need to put a little bit more thought into how we take it and make sure we spend our money wisely so we get the best out of these things. There is also some evidence, anecdotal and scientific, not on the level of the kind of evidence we get with drugs for obvious reason. There's not as much money put in, and it's totally, the principles around their use are a little bit different, but there is some information out there that some herbs can help, you know, enhance antibody production and reduce viral replication. So whereas I don't necessarily think they're going to change your immune system, again, it's more of a supportive role. Most of these things you can take in your diet anyway. So, you know, that's another way where you can get some of these things. So, and I just really wanted to talk just very quickly about this. So there's this national survey going on that Public Health England range, and they look at a range of things in terms of, on average, how much of us, you know, what nutrients are lacking in a general basis on the population. And these are some of the ones that they highlighted. People, especially people on a low income, most of people, you know, on balance, there's, you know, much less wealth in the Black community than there is otherwise. So this kind of affects us, but we need to look at it in context kind of thing as well, because the sample was 86% white and just 3% Black. So now, because of what I'm doing, I'm starting to look at things with a little bit more of an eagle eye kind of thing and really think about the context of the data that is out there. But I think the take-home message I just wanted to say is that, you know, if you've got problems with your, you know, sense of taste and smell, you probably will have a decreased appetite. And so there may be a period during this infection where, you know, taking supplements, the right ones, will help. So have a discussion with, you know, pharmacist, dietitian, whoever, and just get some guidance on what you can take or what might help your particular situation. So just talking a little bit more about vitamin D is an area I probably got a bit sick of because I've had to do so much work in the past around it, but it is an important one to highlight, and I'm just highlighting a few useful ones. And there is some talk that this may actually be the missing link with low infection rates in Africa because they have more sunlight. I think that's a little bit simplistic because I think there's many, factors affecting, the infection rates in Africa kind of thing. And, the data, the way they collect data is one issue, but also there's many other factors that probably are linked to that, but it's just some speculation going on. Weight, if you have a lot of weight, that can also affect your level of vitamin D. And it used to be that we just used to think about this in terms of bone and muscle, but there's a lot of information out there to suggest that this can also have an impact on your immunity and other, systems in the body. And we actually now are starting to see it more as not just a pure vitamin, but actually as having some sort of hormonal role. So there's a wealth of information out there. So I think the important thing to remember is that, vitamin D is definitely a good supplement. And if there is one supplement you should be thinking of taking, then that will probably be at the top of my list. Zinc, quite common in a lot of people, not necessarily, and these things, we have to be careful. Different parts of the world, the challenges and issues are different, and also different countries may fortify certain foods differently. So this is why it's always important to keep talking to people, to keep asking questions so that you make sure you get the right information for where you are and, with everything else going on in your life kind of thing. But again, there may be a role for this as well. Selenium, I think that's something that, is a bit low here. So those are some, and there are many other examples there in terms of things that may help kind of thing or can play a role. So I think lifestyle-wise, in all honesty, there isn't a specific model that we have right now that can, is like a magic trick when it comes to our immune system. The best answer, the best solution is to have a varied diet and to make sure you get a right balance of diet and have enough of a mixture of fruit and veg. So not necessarily having the same every day, but mixing it up. But that being said, there is a specific intake of some supplements may help prevent the onset or severity of COVID-19. Just think about context and trying to get the right information so you take the right thing the right way at the right time would probably be my advice. If you know any smokers or drinkers, or if you're a smoker or drinker, that can deplete certain important vitamins. So that may be a scenario where you may want to ask, what can I take to supplement? I mean, obviously the ideal would be for you to stop smoking and to just drink in moderation. But we know that for some people, that's not an overnight fix. And then exercise. And I just really want to highlight here that it's important to do the right amount of exercise. Too little, not good. Too much, not good either. So just doing the right amount. I think Public Health England normally says for most people, a minimum of 150 minutes a week. And that could be you walking, it could be housework, it doesn't necessarily have to be you going to the gym. You just do what works for you. I think because a lot of people are at home and not necessarily getting that extra movement from work, you may want to try and do a bit more than that. So, and I'm coming to the end now. So where we start, any discussions people have and, try not to keep you longer than I need to. But if you forget everything else that I've said today, I really want us to start thinking as a community about changing our narrative, changing the narrative out there when it comes to health. So I think society for a long time, and I started to sense this and question this a few years back, just before I wrote my first book, has a viewpoint that, without saying it, Black people as a community, we're an unhealthy people because we're at high risk of so many other things. And I think in the context of COVID-19, number one, infection control alone isn't enough. And this is where sometimes I wonder about the government's approach, because from when the data started coming out that, we're more likely to be affected, there should have been a change in approach. And I think it's not just infection control that we need to think about. We need to start thinking about other things we're doing, other things that we can do. We can't control the transmission of this virus. It's a virus. Some people are going to get it, some people are not going to get it. We have limited control, even with all the infection control in the world. But what we can control is those other things that I've spoken today. We can control, making sure we get certain vaccinations, making sure those of us that are diabetic, we take things the best way we can, the right way we can. Those of us that want to take supplements, making sure we take the right ones for the right condition. Let's not just listen to, there's so many marketing gimmicks out there of one thing curing everything. These things have a role, but let's put a lot of thought into how we take it, and let's think outside the box so that we can start changing that narrative. I personally have gotten tired of, I think someone was doing some training with me, and I think the person forgot that I was Black and said, oh, Black people are at high risk of this. Oh, not just that, they're at high risk of this, and I'm just like, no, that also the terminology we use needs to change. Words are really powerful. They teach us that. Those of us that, believe in God, will know that they teach us that all the time. Let's start speaking what we are, what we want to be, and what we are into existence. Because as we start to see it and we start to speak it, then we'll start to live it, and we'll start to get the right information and put things into context in order to force the narrative to change. No one else is going to do it for us. So we need to start taking ownership and doing those things ourselves. And that way, indirectly, we would also force policy to change. Those of us that work in health, let's keep doing, I know a lot of us do other stuff outside work because we're limited on a professional capacity sometimes in the work environment in what we do, but let's try where we can start having those conversations. I was speaking to a drug rep the other day, and I was like, okay, well, what data do you have for, the use of your drug in Black people? So I'm starting to, rethink the way I approach things, and I would encourage everybody here listening in their own way to do that and start asking those questions. Also, if you're a patient, ask the question to your provider. If they say, oh, I think this is a good one, ask them, okay, so do you have any information specifically for this approach in Black people? Let's start, changing that narrative out there. And then also consider the context of any action that you're taking. Just think about the context. So I'll just take a moment to take my breath before I go into the final part where we'll round up and just open up for discussion. So for those of you that don't know me, obviously, haven't figured out by now and that missed the introduction, I'm a pharmacist by background. My background was in clinical pharmacy. I sort of worked as, a HIV specialist pharmacist. And for the last couple of years, I kind of worked in primary care. Now I work part-time in general practice. And I also set up a pharmacy. I set up that pharmacy on the back of running an NGO where we deal with sports and health and we kind of operate international. Most of our events have been in Africa, and we're quite proud of some of, we recently started an online academy. We're quite proud of some of our graduates who were also on the front line with the End SARS movement and pushing for change. So obviously funding has been a challenge. And also as I've sort of grown and developed, over the years in my career, I've also just happened to realize that there's a massive gap kind of thing that needs to be addressed, and the way that things are done mainstream I felt could be better. So this is a way of me, I guess trying to raise funds for the NGO as well as trying to make a difference in my community, because sometimes I go to these meetings and I think I've been to 1 or 2 meetings where they kind of forget that you're there and you're Black, and some of the things being said, but you can't really say certain things even though you know certain things. So I'm hoping that this gives me a platform to do more. So what can we do as a pharmacy? So as the pharmacy that was set up, we set it up sort of in the middle of this year and lockdown, and we do a range of health consultations to support people and help people address their unique issues, and we help people to create a unique solution. We kind of have a special focus on Black health challenges, so challenges within our community. And the benefits of our consultation is that there's a lot of people that, don't even know where to start on their health journey. There's some that do, but maybe they're not too sure, they've got some doubts. So we kind of help you to make that start. And if you've got a health challenge, we help to identify the root cause and not just manage the symptoms, which is what happens a lot of time in mainstream. We also, I find that a lot of people, the NHS is a bit like Google. If you don't put in the right questions, then you will struggle to navigate the system and get the outcome you want. So we can also help you to figure out those questions that you need to be asking other health professionals you may be dealing with. And ultimately, we help you to plan and implement a solution that works for you. The idea being that we reduce your risk of getting a disease. If you already have a particular health challenge or disease, we help you to manage it and help to stop things from getting worse and for you to getting other things. How do we do it? So there's 3 main ways we do it. So we have a 15-minute consultation where we address simple health issues. So if you've got a minor health issue that you just want to speak to someone quickly about, or you have a specific medication or supplement query, then we do that within 15 minutes. Then we have the group consults. We know that everyone's some people's pockets are deeper than others. So we do that, and that we're at the moment, especially because of COVID-19, we're focusing mostly on people that are trying to lose weight, people that may have hypertension or diabetes. And what we cover in those is, again, how to start your health journey. We teach you about numbers. We also teach you a little bit about common drugs and supplements that you may be taking or that may be useful for you. Then we talk about interventions that, health interventions that may work for you or may be a good idea. And ultimately, we help you to set health goals that are specific to your needs. And then we have our main one-on-one consultations. And with those ones, it's, as the name suggests, one-on-one, and it's really giving you a personalized context and goals for your specific situation. We help you to interpret numbers. We help you to create an achievable plan. And, as well as delaying progression or reversing or preventing you from getting a long-term disease, we look to improve your quality of life. Regardless of your condition or medication, that's the ultimate goal, having a better quality of life. But in addition to that, we'll look at your medicines, any side effects or anything that needs to be changed, and really make sure that you get the most out of your medications and supplements. And, those of you that maybe have certain diseases in your family, we kind of look at that and help you to find a way around that. So these are the one-on-one consultations. There are 2 main ones, the integrative one, which is a bit more general, and we look at SMART goals, give you specific things to help you in your wherever you are. We look at your behavior, we give you medication, herb and supplement advice, and we give you 2 free follow-up consultations as part of that package. Weight loss, in addition to that, we give you a weight management plan. We give you 1 more follow-up free session, and then we give you like a lifestyle prescription. So what are our prices? So we've tried to make ourselves really affordable. And the 15-minute consultation, I just thought for today, people that have made the effort to do the talk will be free. So long as you WhatsApp us today on the number below, you can have a free 15-minute consultation. Normally we charge £12.50, but you get it back if you get anything from us. Then if you're interested in a group consultation, that's normally £40 per person. We only do it for 5 people at a time in order to make sure that it's intimate. And we're going to do a 40% discount for people that express interest in that for today. And as well as that, we give you like a free health manual, like a health book. And like I said earlier, I really want to focus for the sake of this talk and COVID-19 on weight loss, hypertension and diabetes. So if you or anyone you know can benefit from it, then just send us a WhatsApp today and we'll send you more information on how to take part in that. And then we have the integrative and weight loss consultations, which are a little bit more expensive because of the intensity. But again, people that are interested in that, maybe their situation's a bit more complex, or they're on, you know, a couple of medicines, or, you know, people that can benefit, we'll also give a 20% discount on that today. So I know that the last time I did this talk, I didn't talk a lot about what we do or how we can help. So I've tried to correct that and really talk also about how we can help and what else we can do apart from just speaking to you and advising you about, you know, some of these general health issues that I hope in some way would also help you in terms of, you know, your health. So I think that's it. So, you know, just finish banging on time. So I think at this point we'll stop the recording and take any questions, or, you know, I know that quite a few people have been listening and may have questions or comments that they want to make. So I just want to, you know, open the panel so that, you know, people can ask